Here we go. Hello, my name is Royletta Romaine. I am the owner of Healing by the Forkful. I'm a registered dietitian and licensed in the state of Massachusetts. I'm also a certified LEAP therapist. And LEAP stands for Lifestyle Eating and Performance. I help my clients reduce or stop symptoms of inflammation, fibromyalgia, irritable bowel syndrome, migraines, and I use food, not medicine. You can find me on Instagram at Healing by the Forkful, or you can email me at healingbytheforkfulrd@gmail.com. My mini podcast is short and to the point. A couple of times a month, I will bring you a new person who has helped someone who has used this protocol or is in need of help has received help from this protocol. Please send me an email if you have questions or would like to be on my podcast. My hope is to reach as many people as we can. So we have a fellow dietitian here who's been doing this for a while. She's been in private practice, and I'm so excited to have her with me. So I'm going to let her introduce herself and tell us all about what she does, and then we'll go through some of the usual questions that we go through.
Thank you, Roletta. I'm thrilled to be here, and thank you for creating this podcast so we can share the beauty of MRT LEAP, food sensitivity, with everyone. So my name is Adiana Castro. I live in New York City. I am the owner of Compass Nutrition, a private practice that specializes in food sensitivities, digestive, and metabolic health. I'm a registered dietitian, and I have been for the past 15 years. And I'm also a CLT, a certified LEAP therapist, and use the MRT food sensitivity test LEAP program in my practice.
Wonderful. So I like to ask everybody that I have on because we all explain it a little bit differently, and that way maybe we can clear it up for some other people who might be interested but didn't really get the gist of it from some other explanation. So tell us what LEAP is, explain MRT, and why it's the gold standard in determining food sensitivities.
Sure. So LEAP stands for Lifestyle Eating and Performance, and it's the nutrition eating plan we start with the MRT results. The MRT is the gold standard for food sensitivities because it gives a personalized nutrition roadmap in building a healthy eating plan that reduces inflammation in the shortest amount of time. It gives clarity on what a person can eat, which in itself is very calming. So food sensitivities occur when the immune system thinks that a harmless food is a threat. When the food is consumed, the body's immune system reacts, starts a chain reaction of white blood cells being activated, and then releasing mediators like cytokines. The MRT is the gold standard for food sensitivity because it's measuring those mediators that are being released from the white blood cells. That is why it's called an endpoint test. It doesn't matter what immune pathway it took. It doesn't matter if it's a type 3 or type 4 hypersensitivity. We are measuring the amount of mediators that were released for each food. And it also tests 176 foods and chemicals so we can create a workable nutrition plan on a variety of foods to help you start getting well as soon as possible.
I think that's key. We start with working with what you can eat and helping you feel better that way instead of focusing on what you can't eat. So
Exactly.
I'm sure you've noticed that there are so many food sensitivity tests that are just popping up. What would you say to people who are debating between doing a LEAP protocol and just grabbing something off the shelf?
Yes, that's a great question because there's so much marketing on those tests, and I know it's very prevalent, so it's very easy to see. And consumers may not be sure what the difference is and why that matters. So other food sensitivities on the market measure IgG response to foods, and their premise is that the higher your IgG levels are to food, the more you reactive are to that food, thus creating symptoms like skin or GI issues. So IgG is an antibody. And there are many antibodies in our system, IgA, IgG, IgM, but IgG is the most common, and it's a type 3 hypersensitivity. All food sensitivities, including the MRT test, do not test for food allergies, which is an IgE pathway. But the problem with IgG testing is the presence of IgG in a food doesn't necessarily mean that it's going to create a pro-inflammatory response. So you can have an IgG level be elevated, and that just might mean that your body decided to flag that food for further inspection. It doesn't automatically mean that your immune system is tagged and that the food is harmful. Another issue with IgG is it acts as a memory or a tolerance for your immune system, which means that sometimes a higher IgG level can actually mean it's protective or normal. Another reason I'm not a fan of IgG, it doesn't test other antibodies like IgM, and it doesn't test for type 4 hypersensitivities. So if you're going to start an elimination diet, you want to make sure it's actually addressing the inflammation problem. And if you're only focusing on one antibody, that's not going to give you a full picture of what's really happening in your body. So you don't want to waste your time or your money on results that actually may not even apply to you, and also, more importantly, not help you get well.
Absolutely. So some people say that there just aren't enough studies on this protocol, which we know decreases inflammation by diet. What do you say to those people?
So, I mean, studies and nutrition research is great, but the amount of time it takes to run a clinical trial and report the findings is around 4 to 5 years, and in some cases longer. So as an evidence-based dietitian, I want to be able to use my clinical expertise, patient preferences to guide dietary recommendations and interventions, and also use the best available scientific research. If I'm using the LEAP program and using the food first approach, and my clients are feeling amazing and getting their quality of life back, I can use my clinical judgment that this is helpful for these populations. I don't need to wait for a study to come out in 5 years to implement this program. Adding food is low stakes, and if I can get someone well sooner, why not?
Absolutely. Absolutely. I love that answer. I know what's going on, and I feel like you're just clarifying so many things. You're making it easy for the layperson to understand this, and I just think it's awesome. So what have your patients said is the hardest part about following this protocol? Because I've done it. It's not easy, but it's totally worth it. I just can't imagine not having done it. My life has changed significantly from doing this, so significantly that I decided to open a practice so that I could share and get other people better. So what do you say?
Yeah, so I live in New York City, like I mentioned. So there's nearly 50,000 restaurants in the city, and dining out is very much part of the NYC culture. So I always recommend they print out their wallet-sized MRT card that lists all their reactive foods in one place. And I tell them to keep it on them at all times. And when they're ordering at a restaurant and the waiter asks if there are any food allergies, I recommend pulling out that card and letting them know you can't have any of these foods listed on this card. So it does take a little bit more prep work. Sometimes it's beneficial to check out the menu beforehand. You want to be able to start being comfortable speaking out and not feeling embarrassed if you have these, special nutrition plan you have to follow. So just prepping your mind for that. I also recommend to, kind of minimize that anxiety around eating out and dining out. Really reflect on what your life will be for the next 3 months. If you're going to be taking a lot of trips, a lot of vacations, if you have a lot of social events, that may not be the best time to start the MRT LEAP program, because you're going to be so limited on what food choices you can have, and that might cause a lot of stress. And then we won't really be able to maximize the results of the MRT, because it's a snapshot in time. So if you take the test, you need to start it within a month. So you don't want to take the test and then wait 3 or 4 months, because then you're not going to get the same results.
Absolutely. So those first couple of weeks, we both know the food choices are really minor. Minimal. We actually pull them down and get you feeling good, and then we add things. Can you tell me about what some of your clients have said about that first couple of weeks?
Yeah, so I'm all about setting up everyone for success. So when we're reviewing the results, we go through each of the sections and say, okay, what are the protein foods, the vegetables and fruits that you enjoy eating that are all low reactive? Because we also want to add foods that they're already familiar with. So if there's a food they've never eaten in the past 6 months or have never eaten in the whole life, that's not going to be a food I'm going to add in that first stage, because I want them to feel confident and comfortable. So we really take our time going through that list, seeing what their food preferences are, picking those least reactive green foods so that we can start having them heal as quickly as possible. And then going through a dietary plan and creating, breakfast, lunch, and dinner ideas, giving suggestions on where to find certain products that they might find, because it's, important to get single ingredient products so you can really know exactly what you're putting in your food. So really helping with that prep work, helping them create their grocery list, having them have recipes on what they'll be eating can bring the anxiety down and really help with higher confidence going into that stage 1.
Awesome. So talk about restaurants and how you set your patients up for success, but what have been some of the hardest challenges that your patients have reported to you? I want to give people a full story because while it works and like I said, just life-changing, it works, but there are some compromises and there's some things that that we do have to watch out for. And I just think it's so great that we don't just give them the results. We as dietitians, we work with them to find and find healthy meals that they can eat with the reduced amount of foods that they can eat. So tell me a little bit about that.
Yeah, I would say another big challenge is, let's say you're part of a family, so you're cooking for multiple people and you're not just cooking for yourself. So even just, giving yourself time to reflect on how that would work, especially if you're the cook and you're going to have to maybe create different meals or ways to incorporate what you're eating for the rest of the family, so you don't have that burden of having to cook different meals. I also talk about how to set up your refrigerator in your pantry, because some days if we got home from work from late and we're not really thinking, we just start grabbing food to eat. Creating a section in your pantry that these are my foods, like this is what I'm eating this week. A section in your fridge or a drawer or on the door of all the foods that you're eating, so that you can automatically add that to your behavior. Okay, I'm going to the pantry in this section. Those are the foods I'm adding to my day. These are the foods I'm adding from the fridge. So it makes it seamless and that it's not something you're constantly thinking about.
Yeah, I have one of those Tupperware sections in my refrigerator. I'm just like, this is my little box. So that is definitely helpful. So what are the most common issues that you've seen the LEAP most successful with helping with patients in your practice?
So in my practice, the top 3 diseases that LEAP has been a game changer for, I would say, would be IBS, fibromyalgia, and migraines. So IBS affects the digestive system, and I find it as a catch-all diagnosis when all other digestive disorders have been ruled out. And it includes those that are suffering with abdominal pain or cramping or changes in bowel habits. The other, fibromyalgia, is also, widespread muscle pain and tenderness, and you can have symptoms of fatigue and cognitive difficulties, and you may have been giving medications that aren't helping. You might be going through physical therapy, but that's still not really getting to the root. You're still in a lot of pain. And with migraines, there's, of course, general nutrition recommendations, such as being mindful of caffeine and alcohol and adding fiber-rich foods and hydrations. But I've had patients that follow all those guidelines and they still don't feel well. So, all those 3 conditions don't have a standard nutrition protocol for everyone. And it just shows how truly unique everyone responds to certain foods. And that's why the MRT is so helpful, because it eliminates the guesswork and we can actually just see how your body's responding to certain foods, which foods are the least reactive, and how can we add them to your day as soon as possible so you start feeling well.
Awesome. What is the shortest amount of time that most of your clients have felt relief?
So I would say within the first 10 to 14 days, 90% of my clients feel 50% reduction in symptoms. And I would say my digestive patients feel it the quickest. Within like day 6, day 7, they start feeling really, really good. So I would say those patients see, immediate relief, but I would say 90% of all my patients get a 50% reduction in symptoms within those first 10 to 14 days.
Okay. I also just want to say here that most people do see it within 2 to 14 days, at 14 days, but there are some people that don't. So I just want you to make sure that when you try this protocol, because you're going to feel so much better, that you don't lose faith, that you stick with it, work with your dietitian, and we'll help you get through it, because once you get to the other side, you're going to feel totally different and fabulous, honestly.
No, exactly. And I think that's a good point. And one of the other conditions, so for clients that it does take the longest, I would say my patients that struggle with skin issues, that can take about 2 to 3 months. I see those tend to be a little bit longer. So it does depend on, what are your main symptoms? What are you coming in for? But in general, everyone always does see a reduction in inflammation. That I see for sure.
Awesome. Now, what would you say to someone who's hemming and hawing and debating about it? Because, like we said, the first couple of weeks, you do have to put your mind to it. You do have to make some changes, have your little section in the refrigerator, and carry your card and be focused on what you are going to eat, so that you can see the best results. So, what would you say to somebody who's just debating, like, should I do this? Is this really going to work?
So I always say, why not start with food? Food is a non-invasive way to help with inflammation. Usually, many of my patients have ruled out everything else. They've already gone to countless doctors, they've completed many tests, and they're really frustrated because they still don't feel great, yet they've spent all this time, all this money, and they're still at square one. So that can be really frustrating and disappointing. So I always say, well, let's try food. We all need to eat multiple times a day. And if what you are eating, regardless if it's a whole food or not, may be increasing the inflammation in your body, you trying to figure that out on your own is going to be really hard, because with food sensitivities, they're different from food allergies. They can be delayed. It can be up to 3 days later that you feel a symptom of the food that you had 3 days prior. So being able to pinpoint that is going to be very difficult given our lives and how many meals we've had in the interim in those 3 days. So the reason I love the MRT Leap program is I test, I don't guess. And then I get a very personalized nutrition plan based on your blood work. We create the menu and it takes into account the results, but as well as your personal food preferences, so that I can set you up for success. And I always remind everyone, this is a very therapeutic and temporary state. This isn't something that will follow for the rest of your life, because food sensitivities do change. But we want to be able to bring that inflammation down, feel really strong, and then we start expanding and adding more variety, so that you do have a really diverse diet and you have a good sense on what foods are really helpful for your body and help your body, thrive, and other foods that maybe you have to have less of, and there's maybe a threshold for certain foods that can help, reduce that inflammation. So with this
And I think
test,
that's key. I'm sorry. You're saying that there's a threshold. So some people think that they can't have this food ever again if it's one of their favorite foods, and we find that it is on their list. Can you just go into that a little bit
yeah.
more?
So food sensitivities change. They're not like food allergies. So that's why when you take the blood test, it's a snapshot of what your blood is doing at that moment. But as we are able to reduce inflammation, and as we're able to heal and seal the gut again, like I say, then we're able to find that we can start reintroducing some of those highly reactive foods. And because they've been out for, let's say, 3 months or 6 months, when you add them back in, we can add them very methodically. So we can start off with a small dose and see how your body responds. And then we can titrate up and see what your threshold is for that food that was previously reactive. But more than likely now you will be able to have some of it.
Awesome. So looking at the list that I gave you, and I can't even believe that I don't have this on, but my favorite question is, tell me about 2 of the patients that were just so successful and so happy that they actually tried this protocol.
Yeah, it's funny. My first patient was one of my most memorable patients, and not only because he was my first patient, but he was so sick. He probably had one of the highest symptom scores that I saw. It was about 180, and it was impacting every part of his life. He was on the verge of divorce. He was falling asleep at work and was about to lose his job because he wasn't able to function. And he was at his wit's end. And we have this program that I just started implementing. And I said, let's just try this. Let's try with food. And it completely changed his life. He was, after the first 2 weeks, all of his digestive symptoms had gone away. After a month, he was feeling so much more clarity and mental clarity at work. His marriage was now back on track because he was able to be there for his wife. So, I mean, it was just an amazing first patient to complete this program with, that it was so memorable. I can't forget it. And I wouldn't have
totally is. Because a lot of people don't realize, oh, I'm so sorry. Most people don't realize that when you're not feeling well, it affects everything about around you and everybody around you. So when you're feeling better, people around you are feeling better, and life is just so much easier and happier. I didn't mean to cut you off. Please
Oh,
continue.
no, that's okay. It's so exciting to hear these stories, and it's exciting for me to even to continue to remember it because it was so memorable. But what I was saying is I wouldn't have been able to help him if I did not have this test, and we did not have this very personalized result to create this nutrition plan to help bring that inflammation down because it was so severe.
Awesome. Do you have one more?
Sure. So yeah, I have plenty. So I'm trying to think.
That's so two.
Yeah, that's my most memorable one. So I always use that one, and it happened to be my first one. So then I was sold on MRT for moving forward. But another one was a young lady, and she was having terrible migraines, missing a lot of time from work because she had to be in a dark room with the door closed with no noise, and she just was again on the verge of maybe losing her job because she just wasn't able to perform because she wasn't able to kind of reduce the headaches. And she had tried the general nutrition recommendations and it hadn't helped. And when we got her results back, she culturally had a lot of Italian foods, and all the Italian foods were on the list of pasta and olive oil and garlic. And her face, I remember, was like, oh my gosh, how am I going to do this? And I said, I really tried to stress, I know this is, not what you probably hoped for, but remember that this is therapeutic. This does not mean you can never have these foods ever again. And we want to remember why we came. Like, let's look at the, migraines, the impact it's having in your work and quality of life and your friendships and your relationships, and just say this is temporary, right? So we were able to implement the diet, and, within a few weeks, her headaches were disappearing. She wasn't having to, retreat to a dark room with no noise. She was able to go to work, not calling out. And she was young. She was in her 20s. So it's awesome to be able to address this in your 20s, not struggle for decades into, adulthood. So that was a really, special case as well.
Mm-hmm. That's awesome. So many people don't think about, presenteeism. You're at work, you're doing what you can do to survive, but it's not your best. And then a lot of times you end up staying at work longer because you still have to complete the same amount of work. So then it drags onto your life, and then it gets worse because you're always at work, always doing something, and it's just so hard that people don't think that just what you're eating influences everything else around your life. So that is an amazing story.
Yeah,
wow.
Yeah, exactly. I don't think everyone gets the quality of life markers. Like even mobility. We live in the city, so being able to go up and down the subway, going on buses, walking everywhere, walking up steps, not everywhere is has wheelchair friendly, so you have to walk up steps. So being able to play with your children, going on the ground and playing with them and having the energy to do so. Those are those quality of life markers than just typical digestive symptoms we might be thinking of, like gas or bloating or constipation or diarrhea.
Okay. Now I feel really bad because I'm totally enjoying this conversation. I need one more, and then I promise you can go. One more. If you can think of one really, really quickly, because I know you need to get on with your days as well.
Yeah.
But
no, I love
me as a therapist. I'm so excited now. I'm going to listen to this one a few more times and maybe have you back to talk about a few more stories.
Yeah. So there's another story, and one recently. So she had been struggling with digestive issues for a long time, and she had been going to the GI doctor, and everything was coming back negative, but she was barely eating food. She had thought, I think these are the only few foods that I'm able to eat without having a reaction, and becoming then fearful of so many other foods and fearful of going to social events or going out because unsure how her body is going to respond to that. And we know well that gut-brain axis is real. So if your mind is anxious about it, then your stomach will also be anxious about it, and vice versa. So another reason why I love the MRT, it can help bring that anxiety level down because now we're not guessing. We're not just, saying, well, we'll try this and we'll see what happens. No, we have these results. So we were able to get her results, and she was actually super excited because for the first time, she felt comfortable adding foods, adding foods back in that, oh, that is low reactive. Awesome. I haven't had that in years. Let me try it back. So there was a few of those. Some of them um, she was eating that became reactive, but she was just so happy that there were other foods now that she could even try and just having more options. And she also, lived with her partner and wanted to be able to eat with him and be able to, have that part of their lives be intertwined. So we started adding foods and she was feeling great, feeling so excited. Her energy came back. She was having very low energy because she wasn't eating a lot of food because she was, she became fearful of food. So being able to have that freedom to say, yes, I'm going to add these foods. These foods are going to help me. They're not going to hurt me. Is that mind shift is amazing.
Oh, I love it. I love it. Thank you so much. I'm going to close up unless there's something else that you want to share that you just feel like you have to say before this is over.
Yeah, I mean, I would just say go for it. If you want to do a food sensitivity test, I would just recommend to do the MRT LEAP one so you get the most benefit and the most bang for your buck because it typically is an out-of-pocket expense. But it's so worth it, especially if you're struggling with your health and you've tried everything else. Why not try food? It's super and low invasive, and everyone needs to eat, and being able to have that opportunity to create a plan that works for you, I mean, is priceless in my eyes.
Absolutely. Oh, I'm so excited. It's been great talking to you and listening to these stories. I just want our listeners to remember that lots of disease states are caused by inflammation or worsened by inflammation, arthritis, brain fog, migraines, fibromyalgia, diabetes. The list goes on and on. And if you're out there wondering, remember, I don't just give you the results of the test. I work with you to make sure that you can have the most success that you can get. We review the results and support you and help you on to a less inflamed life. So why wouldn't you just start with food? Let's get you started. Thank you so much for your time.
Thank you for having me.